President Trump celebrating in the Rose Garden after House Republicans narrowly passed the GOP's health care bill, sending it now to the Senate, where it will face, of course, a second round of scrutiny and hurdles. The new bill is moving ahead, though, without an updated CBO score. So what are the economic impacts? Here is the man who really is the most important, perhaps, to discuss this with, Grover Norquist. Grover, a lot of misgivings. In fact, I think earlier this morning, Lindsey Graham putting out a tweet about this not having a CBO score, and then not too long ago, Doug Elmendorf saying it was a, quote, terrible mistake for the House to go through this without the CBO score first.
The CBO will do a score. It'll be important. There's no reason to hurry it. We need to move forward with this legislation. It goes to the Senate. This eliminates the individual mandate tax on 8 million Americans, trying to force them to buy Obamacare that they didn't want to buy into. It is tens of billions of dollars on the taxes on businesses to force them to make their employees move into this program. So it removes, over a decade, $1 trillion in taxes on the American people. If you have a flexible savings account, the Obamacare tax on you is removed. The tax on health savings accounts that Obamacare put in, that's removed as well. The tax on medical devices, which makes every operation cost more, that's removed. The tax on insurance companies, which makes your insurance cost more, that's been removed. So this is $1 trillion in lower taxes. It reforms Medicaid as well. It block grants Medicaid out and allowed states to have a lot more leeway on how they handle Medicaid rather than one size fits all. It reduces the deficit, actually saves more in overspending than it cuts taxes, but it cuts spending even more. And it reduces total government spending from about 24 to 23% of GDP. So it's a permanent reduction in the size of government here. It's a big deal, and the Senate will do something like it. They're the Senate. They'll have to touch it. But it's a great step forward. Now,
of course, some would argue, again, looking at the estimates on this, at least the original version of this repeal, the way they'll coin it is, hey, we've thrown 24 million people off of health care, and when they crunch the numbers, they'll come up with some magical figure that this ultimately costs the economy trillions of dollars.
Well, okay, the left is going to just go nuts because they don't like the idea of having Obamacare's central thing largely removed. So they'll just say anything and do anything, and just better be ready for that. But the argument that if you don't have mandated taxes to force people to buy Obamacare, and once you remove that threat, CBO says many people won't buy Obamacare because it's lousy coverage for a lousy price, and if you don't make them do it by taxing companies or individuals to force them, they will leave. That's not being denied health care. That's saying if you don't make somebody do something and they choose not to do it, they've been disadvantaged? No, they've been mauled for 8 years now by Obamacare.
Right.
And now people have the choice of whether to continue or do something else.
Quickly, Grover, now tax cuts / tax reform.
Yeah.
Does the GOP, should they go ahead and start working on that immediately, or do they wait for this next Senate hurdle with the House health care vote?
The House has been writing that tax bill for the last several years. The Senate is doing its own thing. I don't think they started quite as quickly as the House did. But the House and the Senate have been working on tax reform for
many months. Right, but the assumption is, though, you take these savings that you just described, the $1 trillion, and that helps you a lot to do some of the things they would like to achieve without being desperate, right? Like border adjustment taxes and things like that.
It is a big help. It moves us $1 trillion closer to fundamental tax reform. This is very important. But as this moves forward in the Senate, the House and the Senate are now, as we speak, moving forward to get tax reform done. This bill will have to pass first, and then we can pass the bill on tax reform. But we're not waiting to write that tax reform bill. That's happening now. The White House, the House, and the Senate are all working together. And as President Trump says, it's a very large, significant pro-growth tax cut.